right, guys. Let's go ahead and get rocking. So, thanks for coming. Appreciate you taking time to spend 45 minutes with us this afternoon. Well, hopefully we're going to introduce a concept that can help you feel better. So, thanks to Keegan and Motion for helping support this and helping put the presentation together. So, thank you. And then I'm Ben Van Treese. This is Minerstown. We're a gym. We help people who hurt, not hurt, so they can play in the mountains. That's kind of our general mission statement. So hopefully most of you here that vibes with. So our main goal today is to define neuroplastic pain. What is it? So you have an understanding of what that is. And then define what a neural reset is. And then we're going to give you some education on pain science, and like neuroplastic pain that will be helpful for you to know. And then that'll take about 25 minutes or so. And then we're going to spend the rest of the time taking you through a neural reset for, like, specifically for low back pain. And you should have that, be able to take it home, know what to do with it, and use it for the next month to get yourself feeling a little bit better. If you have any like acute back issues, where's Michelle? Meaning you just got back surgery? This is not for you. This is for the person who's had back pain, back stiffness, general achiness for longer than 12 weeks. That's when it goes into a chronic back pain kind of mode, and that's where this type of thing can be really helpful. If it's an acute pain, oftentimes that can be a structural issue, and you should go see somebody like Keegan to get that assessed, figure out what it is, start to get it fixed. Anything else you want to add to start?
No.
All right,
great.
Sweet. So what we're talking about, why your back still hurts, what your nervous system has to do with it, neural reset for low back pain. So go ahead. So back pain can be really hard to fix. Most of you guys sitting here probably know that. Most treatments focus on tissue, and pain is often driven from the nervous system when it's lasted past that 12-week mark. So today we're going to look at how can you reset the nervous system so that it stops giving you pain signals even though the tissue is no longer damaged. So that's what we're talking about today. So key takeaway is often low back pain is a software problem, not a hardware problem when it's chronic. And that's why this is for people with chronic pain. So your all tissue heals within about 12 weeks. So if you get a total knee replacement, the tissue in that knee is good, it just needs strengthened and built back up after about that 12-week mark. Same with the shoulder, same with the leg break. Tissue heals, the body's pretty good at that. And sometimes the pain signaling from the nervous system gets a little messed up, and that's where a lot of chronic pain comes from, and that's something that can be solved. So the best tools that you have today to fix that is movement with your breath in a very specific and very intentional way can start to reset that system over a 4 to 8 week period. And then once we start to get it reset, you've got to restore confidence because fear breeds pain and pain breeds fear. And that's something that you can start to accomplish. And then we restore movement and we build resilience kind of as you go through that. So this is really cool. Can we actually change chronic back pain? This is a study that was done at the University of Colorado in 2022. They had 150 participants that had chronic low back pain. The age was 20 to 70 years old. The mean duration of back pain across all 150 participants was 11 years. So they'd been dealing with some self-reported pain for quite some time. They broke them into 3 groups. One was pain reprocessing therapy, which was a therapy designed to solve and eliminate neuroplastic pain. And then they had placebo group, which was like, we're just going to track you guys, but we're not going to do anything for you. Which, bummer. And then you had your usual care, which that's your steroid injections, physical therapy, chiropractic, massage. It was a 4-week intervention. They did a 1-year follow-up. At 1 year, 68% of the participants, of the 50 people that went through pain reprocessing therapy, self-reported a 0 or a 1 on their level of pain and discomfort, which is a very high number for this type of intervention. And the goal of pain reprocessing therapy was to solve neuroplastic pain. And then placebo care and usual care, that was about 20% at a year out, reported 0 or a 1. So a pretty significant result there. This study has been replicated, and it's worked several times in randomized controlled trials. And that's the best level of research that we have access to. So changing how the brain interprets pain can dramatically reduce chronic pain. And that's what we're talking about today. With a neural reset, what we're taking you through is a piece of the PRT program. And it's all movement-based, and that's what we're best at teaching people, so we're doing the movement piece of that. So next one, Keegan's going to talk about this study a little bit, so let me give you...
Yeah, so like I said, I'm Keegan. I'm a physical therapist and a sports resident here in Park City at Motion. We have 2 locations, one in Park City and one in Heber. So I'm going to kind of take on kind of this kind of slide right here. And I love that he kind of put this in here because a lot of times one of the first things that we go into is let me get an image of the back. Let me see what's going on. There's something structurally going on. That's what's causing my pain. Literature has actually shown that if you pull anybody off of the street, just anybody random person, throw them an MRI, they are likely going to have some sort of disc issue, degeneration, any sort of protrusion, that sort of thing. Doesn't matter how old or young they are, right? And this is kind of what shows it. It does not necessarily mean that that is what is going on. It can, but that's when we have to start teasing out, like, is it actually a structural issue that is pinching on maybe some of the nerves or the tissues or something like that? Or is it actually more like we're going into this neural reset that needs to kind of happen? And I think this is kind of really interesting because, yeah, like I said, everybody thinks that, okay, well, I have a bulging disc or I have degeneration. That's what's causing my low back pain. Let's immediately go into a surgical intervention. Now, there is a time and a place for surgical intervention, and that can be helpful, assuming nothing is really kind of working. We've tried a bunch of different things. We've had consultations with docs and everything. That is possible that we need a surgical intervention. But I love that we included this because just because your MRI says one thing does not necessarily mean that that is actually what's going on. We need to kind of dive deeper into this to see what is actually kind of going on with you. So,
what I really like about that study is if at age of 60, it was 88% of 60-year-olds have disc degeneration, and it's a slightly lower number for disc herniations. So if those were causative, like 88% of the population would be right there at age 60, and that's not what happens. So it's pretty cool research. Now, hardware versus software. It's super common to have software issues. It's the nervous system sending a signal because it doesn't feel safe. So the nervous system feels threatened, and that ends up creating a physical pain. That's been well documented, and that is a cause of chronic low back pain that's fairly common. And so if you try to fix your hardware issue when you have a software issue, you still have an issue. A lot of people, once you start going down a surgical route for back pain, you end up getting more because oftentimes the disc might not have been the problem. So it's really worth teasing out with a good PT group before you go that route. Next one. So I want to talk a little bit about a healthy spine. So you've got your cervical spine, your thoracic spine, your lumbar spine. A lot of people that have low back pain have a strong interest in posture, meaning, oh, my posture's bad, that's why my back hurts. And so it's important to note the spine looks like an S. So you've got a little arch in your low back, a little rounding in your mid back, a little arch in your neck. So that good posture, military parade rest where you're tucked under and like this all the time, that's actually not the shape of your spine, and that's not helpful to get your spine to relax because you're using the musculature and the nervous system to hold your spine in an unnatural position. The most important thing about posture is your next posture. So if you're like this for hours, you're going to come up with some issues. If you're like this for hours, you're going to come up with some issues. So it's important throughout the day to, if you're an office worker or if you work on your feet, to be able to assume different postures and kind of move throughout those postures throughout the day. That keeps blood flow going, that keeps lymph fluid moving, and that keeps tissue feeling good. An example of that is if you've ever flown to Europe, not in first class, you feel kind of shitty when you get there, and there's been no damage, just things haven't moved. So trying to hold a static posture all day will perpetuate a state of discomfort if you already have that, and it can create one if you don't. So movement is key. We've got 25 articulations if we're looking at just the vertebral level from the cervical spine all the way down to the lumbar spine. We need relative movement between each vertebra, meaning if we have one bone and then your next bone, those two bones need to be able to wiggle relative to one another, and that happens in millimeters, not inches. So it's very small movements, but if we can keep segmentation of the spine, you're pushing spinal fluid up and down the spinal cord, you're pushing lymph fluid through the tissue, and you're pushing blood flow through the musculature. And all of those are necessary to create a safe environment where the nervous system can start to relax and start to get rid of any of that neuroplastic pain that you have. So motion is lotion. Just the more you can move without hurting, the more you will be able to move without hurting. And always remember that when you're trying to figure out what's the right thing for me to be doing. So spinal capabilities that are important for a healthy spine. We need segmental articulation. That's the little wiggling of vertebra against each other. We'll talk about how to accomplish that if you can't. Movement variation, so you need to be able to load the spine in a variety of ways. A lot of people with back pain are told kind of stay in your phone box and make sure if you bend, make sure it's only from the hips. So we're going to pick things up here. We're not going to round the spine. And that can be protective in an acute bout of pain where you just need to avoid moving that tissue. But if you don't use it, you lose it. So if you end up skiing and you get barreled and you end up like this, that tissue no longer has the capacity to handle force absorption outside of this position here, and now you're going to get a pain signal. You might get a tissue injury. So it's really important to keep the spine moving in all positions as much as you can and avoid the areas that hurt when they hurt. And we'll talk more about like the level of pain that's appropriate or not. Postural endurance, we need strong enough muscles along the spine to be able to stand or sit, to get through work, to get through life, to get through a party. Like that kind of thing is very important. And then this builds on movement variation, strength training through a full range of motion. We need to take the spine in all the positions and gradually load it to keep it strong, resilient, and healthy, and to keep it feeling safe. Your nervous system knows if it can communicate with tissue in this position, but it hasn't been here for years. So that's going to send a danger signal, and that's going to create more of that neuroplastic pain that's not useful, and that's something that we can do with this neural reset. So the ability to produce and absorb force rapidly. If you're out for a walk, you catch your toe, and you stumble, a lot of times people with chronic back pain will be like, oh! And so the spine and the tissue around the spine is no longer able to contract and absorb that force rapidly. So that needs to be something that you keep in your training, and there's a lot of ways to do that working around your pain as you start to feel better as you go through this reset. So healthy movement, go ahead, next one. Keegan's gonna talk about structures that support a healthy spine.
One thing that I want to start out kind of building off of what he talked about when we think about the structure of the spine is a lot of people that I've seen in my personal career have come in saying my spine feels unstable, right? When I move, I get that little creak and I have to like pause and then come back up. That starts to change neural pathways. And one of the things that we've started to do is educate people that your spine is stable, okay? It is surrounded by tons of ligaments, muscles, everything around there. The bones are oriented in a very specific way to make sure that it does not have any slippages or anything like that. So sometimes when we look at low back pain, sometimes we have to just tell ourselves, my spine is stable, my spine is stable. Structurally, it was designed that way. Now, there are times when you have impact or sort of things, you can have slippages that occur, but generally those are rare and kind of far between. So when you feel that kind of bend over and that twinge, your spine is stable. It's just we need to retrain kind of the movement, retrain the muscle coordination potentially, but your spine is stable. So I wanted to kind of build off of what Ben was kind of saying, starting with there. So one of the things with structure supporting the spine, in my experience as well, sometimes the spine just ends up being a punching bag for something that could be unstable or not moving correctly in other places. A lot of times our upper back, our hips, knees, ankles, that sort of thing. And then where do we take the brunt force? Right here in the low back. So that includes the hips, pelvis, ribs and diaphragm, abdominal wall. When we think about strengthening the core, that is a portion of it. But we also need to think about other places. A lot of times in our low back, everyone said you need doctors or PTs. I'm guilty of this, so I'll raise my hand for that. I've said you just need to strengthen your core more. You need to strengthen your core more. And I think so much emphasis gets put here, and that's good, and we need that, and we do that, but we need to focus on these other places as well too, because again, your low back could just be a punching bag for something else that could be going on. Shoulder blades and ankles as well. Now, I put a little asterisk on the pelvis because this is something that is, I think, I have recently kind of been diving more into as far as like probing and questions, especially with female patients, pelvic floor health. And how that can actually present itself as lower back pain. So I personally don't treat pelvic health. There's male pelvic health and female pelvic health as well too. We do have a physical therapist, Maddie, who treats out of our Heber location, who does do pelvic floor. So if you notice that when you have sort of issues kind of in that region, you get low back pain, that might be worth going to see somebody specifically for it, because again, it could be something else manifesting as low back. Specifically, more often than not, it's females, especially with any sort of like incontinence, after having multiple births, C-sections, those sort of things that all can increase a female's likelihood of having low back pain. So if you're experiencing something like that, could be your low back or could be something else maybe in the pelvis region that is referring kind of up to it. So, but kind of a TLDR, your low back might just end up being like a punching bag for something else. So we do need to kind of look at these supporting structures as a way to help support it. But your back is stable, and I really want to emphasize that. So much of it was designed to be a stable piece.
Yeah, we're not so maladaptive that we survived for however many millions of years and now like we can't bend over, right? If we couldn't bend over, we wouldn't have made it this far. So this is kind of the fun part for me, keeping the spine healthy. So healthy movement patterns, you need to have awareness of the tissue, you need to have control of that tissue, you need to be able to move that tissue in three-dimensional space, then you need to make it strong, then you need to make it fast. So awareness is if we ask you to kind of go quadruped, and then I just want you to move your lumbar spine. So can we just get the lumbar spine to move without anything else? And nothing happens, everything moves, just something where it's not just the lumbar spine. There's lack of awareness where that tissue is. So your nervous system's not getting good communication from the tissue about what's happening in space. That's going to cause the nervous system to create guarding, stiffness, and tension down there, because it doesn't know what's going on. So it's better for it to hurt and not move, because you can't hurt it if you're not moving it, than it is to go into positions that it can't handle and then actually blow something up, tear a muscle, tweak a disc, that type of thing. So for the awareness portion, what we do is we put constraints around you so that you can only move where we want you to move. And then we move on to control. We start to remove constraints. So you're getting less feedback from the environment. And now, can you still move that? Sweet, we've made progress. And then we remove all the constraints, and can you just get your low back to move without anything else happening in 3D space? And then we're going to add strength to that, and that's building resilience, that's building confidence, and then we're going to add the ability for that tissue to be able to absorb force rapidly. And that's necessary for hiking, biking, skiing, tripping on curbs, kind of just daily life in general. So that's kind of the progression that we go through to keep a spine healthy. And then go ahead. So causes of low back pain, this one's all Keegan, the PT.
Yeah, so kind of like I said, there's a lot of reasons that could be causing your low back pain. There actually could be injury, which could lead to any sort of like surgical intervention, right? There is time and a place for that, and I see that regularly, right? I see post-op back pains for discectomies, microdiscectomies, fusions, you name it, right? That's definitely a place where you need to come see me or another physical therapist first, and then hopefully we can transition you into kind of coordinating with our strength and conditioning thing. So one of the things that I also, in my residency, in my didactic coursework, as I'm going through this, that we have put a lot of emphasis on has been this stress management, sleep, diet, hydration, triggering incidences, that sort of thing. There is a whole classification system of when we look at low back pain, we start to put you into bubbles of how do we want to treat you best. And you can be in multiple, but one of them is low back pain with affective or cognitive tendencies. Basically, there is a mental piece to this, right? You've been dealing with this for a long time. It has caused stress. There may be other things in your life that could be causing stress that can be causing more back pain. I know just recently I had a patient who's been dealing with back pain since the early 2000s. Structurally, again, the MRI looks amazing, but she still has debilitating back pain now, spreading down into her feet and giving her migraines, that sort of thing. One of her exercises that we're kind of just working on is stress management. I have her just going out, doing a walk, and just doing a mental check-in with herself. She's also doing the same thing with her husband. How can he best support her? How can she best support him? Doing the same thing with her kids as well too. Doing those general check-ins to see where can we manage that stress. I think so often this piece gets so missed in causes of chronic low back pain because, like Ben said, after a certain period of time, the body is built to heal itself. And now we start looking into these psychosocial factors that could potentially be causing it. Sleep, diet, hydration all play into this as well too. And then kind of this last one, age-related changes. I always just tell my patients, getting old sucks. Sometimes we get done with the evaluation, they're like, what's going on? I'm like, well, you're 70 years old. I'm 30. I'm getting there too. Like over time, getting old sucks, right? That's just part of it. Welcome to life. I'm still really young as well too. I know that, but getting old sucks. So that is part of it. And just recognizing that as we get older, your body is going to experience aches, groans, pains, that sort of thing. That is considered normal. With help of strength and conditioning, physical therapy, and kind of tackling these psychosocial factors, we can limit and mitigate these sort of things. So I really like this just because of that poor stress management. I think there is a huge part of it. Everybody, I feel like, even if you do have any sort of radicular pain or mobility deficits or something like that, bulging disc or something, I feel like it does eventually put you into these affective and cognitive tendencies because it does put stress on your life. You can't work, you can't sleep, you can't do the fun things, can't ski, can't mountain bike, can't all these things because it hurts. And that takes a toll on you and makes things worse. So.
Yeah, the stress management piece is huge, but that's not what we're lecturing you on today. But don't shave that off because there's really good evidence that a lot of chronic pain is neuroplastic and not just low back pain. And we'll give you some resources if you want to dive into it at the end. So training principles, when you're trying to work through this, this is not for the neural reset. You should experience zero pain when we do the neural reset. I'll say that like 5 more times before we get there. But you want to limit activity, but pain up to a 3 to 4 out of 10 is totally fine if it's familiar. So if we add new exercise, new activity into your life, and you're like, it's like a little funky, but it's a 3 or 4 out of 10, that's totally fine. That's not going to set us backwards. Now, if that pain starts shooting up to 6, 7, 8 out of 10, that's absolutely not fine because that's going to send a danger signal to your nervous system, and your nervous system is going to reinforce that neuroplastic pain that it has. And then, so pain cycles fluctuate. It's super normal to get out of pain, have pain-free days, and then occasionally you're like, oh, kind of hurts again. What we need is not a fear response. So we need to eliminate the fear response to experiencing the pain in order to get that neuroplastic feedback loop to stop. So that's really, really important. Segmental spine training is a really, really good way to get your spine to feel safe. And there's going to be some of that in our reset that we do here in a minute. And then the cognitive part, you have to believe that your spine is strong, that you're capable. You have to have a positive attitude because neuroplastic pain comes from the brain. So if you have neuroplastic pain and you feel it in your back, the signal doesn't come from your back. The signal comes from your brain, and that pain signal is sent to your back. So if you believe that your spine is broken, your spine will remain broken. That's how that feedback loop works. So there has to be an element of belief. And that's where reading the research can be really helpful to get you to a place where you're like, oh, actually spines are stable, tissue does heal, this is probably neuroplastic, and I can change it. But the only person that can change it is you by doing the work. And understanding that all tissue in the body occasionally hurts. If I were to be able to like magically inject forearm pain into you, that's like kind of severe for 2 days, and then it went away, there most likely would not be an emotional reaction to that. After a month, you'd probably forget that a month ago your forearm hurt for 2 days. But if I did the same thing to your low back, it's going to most likely trigger a fear response, like, uh-oh, is this going to be forever? Like that type of thing. So if you've been feeling good and you tweak your back, try not to respond emotionally. That's really important for breaking a neuroplastic pain cycle. And then Keegan said it earlier, tissue heals, the body's amazing. So if your pain is lasting past that 12-week mark, pretty much all injuries heal within 12 weeks. Now, if you've had a surgery, your return to sport is much longer because we have to add tissue resilience, we have to add strength, we have to do a bunch of stuff. But the healing happens within that 12-week window. So next one, what's a neural reset? So if we have neuroplastic pain, that means your pain signaling's turned way up and movement signaling's turned way down. And in healthy tissue, and if we don't have neuroplastic pain, movement signaling is high and pain signaling is relatively dormant. It doesn't do anything unless there is some sort of injury, and then they start to kind of flip, and then the injury heals, and then movement signaling goes back up, pain signaling goes down. So for a neural reset, we need to remap that pain loop. So what we're trying to do, turn up movement signaling and turn down pain signaling. And we're going to teach you one strategy today that can help with that. So it is not strength training, it is not stretching. It should feel like you're mostly doing nothing because we're going to get the tissue to move without triggering that pain signal. And over time, that pain signal will start to get quieter and quieter, and the movement signal will get louder and louder. And that's how you get out of that neuroplastic feedback loop. Next one. So for a self-reset, you can do a self-reset, you can do a provider reset, and if you put them together, it's even more powerful. So self-resets are always driven from the breath. So diaphragmatic breathing, we're going to go over some breathing techniques here in a second, to increase parasympathetic tone. That's rest and relax. So that allows you to start to feel safe. If we want to break a pain loop, we have to get the nervous system feeling safe. The best tool you have for that is diaphragmatic breathing. And that's going to reduce that protective guarding that you get with neuroplastic pain. And then all of your movements that we do today will occur during an exhale. There will be no movement during an inhale, and that really pushes the button to ramp up parasympathetic tone, which gets that system to calm down so we can get more and more movement without getting more pain. And that's what we're looking at. And so for the provider reset, Keegan's going to talk about that a little.
Yeah, so this is kind of where we can kind of come into play, whether it's a post-operative care or there's any sort of like potential like shooting kind of pain down into the legs or something like that. We start getting into more of like a radicular kind of issue. But first and foremost, we start out with like a thorough evaluation. So we want to kind of dive into not just current history, but past history of any sort of trauma that could have happened. We can use to basically to establish any sort of root cause, seeing whether it actually is the low back that actually is kind of the issue for it, or is it kind of like a pelvis driven, or is it upper back driven? Is it knee driven or something like that? Some people start out they had like a knee replacement or something like that, and now it didn't heal up properly, and so now they're walking funky, and now it's their back that's the issue or something like that, right? Was it an ankle, a long-term ankle issue that's now making gait weird, that's causing low back pain? Shoulders can do the same thing as well too. So trying to get down to the root cause is kind of the first, so we can establish what's going on and establish goals. There are therapy goals, and then there are personal goals, right? I have goals for myself, right? I have goals for you, strength, mobility, that sort of thing. But you have your own personal goals: mountain biking, skiing, yoga, Pilates, whatever it is, right? That's dancing, whatever it may be. Those are your goals, and we're going to kind of work towards building towards all of our goals. We can't end the manual therapy, soft tissue mobilizations, dry needling. If you've ever heard of dry needling, it's similar to acupuncture. Those sort of things are a small piece of your overall recovery. They help, but they are a small piece. We'll say maybe 10%. If you're looking at a full 100% thing, maybe 10% of it. We can look at desensitizing the tissue and releasing tension, whether it's through kind of my hands, kind of reintroducing mobility back into the spine itself, me pushing on it, or using something a little bit more, you can call it invasive, in the dry needling, where we can actually release trigger points with those needles. Nerve mobility is a big one. Your nervous system loves to move. It loves mobility. It loves blood flow. And so your body is meant to floss the nervous system, but it's also meant to be tensioned as well too. Now, initially on, tensioning is what is probably going to elicit maybe some of your symptoms that you're going through. We want to start out with a floss, just getting that nervous system to kind of move. And then we start getting into like a progressive overload. The nervous system also loves blood flow. So one of the things early on that we'll try to get you back doing is getting your heart rate up in some way, whether it's walking, biking, rowing, swimming, whatever it is. I've even some people that can't tolerate standing for very long, I have them sit and do like a ski erg machine, right? Just something to get their heart rate going, get that blood flow pumping. And then we progressively overload through strength training. Now we start out maybe trying to just decrease kind of these, like Ben was talking about, decreasing the sympathetic nervous system, that fight or flight mode, and increasing your parasympathetic nervous system, that rest and digest. And then as we get through that, then we start to make it harder and harder, getting you back to your goals, getting you back out. Honestly, one of the things that I tell my patients is my goal is to have you fire me and never come back. That means that we've done our job, right? Now, I'm always here if you need me, right? But the goal is to have you come in, learn what you need to do, get better, and I'm going to kick you to the curb and say, don't come back because you know what you need to do, kind of thing, right? Good business model, bad business model at the same time. But also works really well because then if I did my job right, you did your job right, you recommend more people to come see me. It works out for everybody. Targeted home exercise programs to achieve your goals is kind of that thing. We like to do a multidisciplinary approach. This includes coming and seeing like our strength and conditioning partners, and then getting into that mental health as well too. Like we talked about, that psychosocial aspect of it. This doesn't necessarily always mean going and seeing somebody, but having those mental check-ins as well too. And then if you need it, going and seeing somebody to help like work through your stresses and everything, because it is a huge part of your overall healing as well. And I think with everything that's gone around in the world and everything in our personal lives, I think that just plays so much into it. So taking time for yourself to have that mental check-in.
All right, we're about to get into it. So why it works, right? If you're in a state of chronic pain, especially in the back, the most common trigger for that is the bending over. And your brain interprets that normal movement as a threat. So we've got to make the brain feel safe. And once we have it feeling safe, we can start to slowly and progressively reintroduce movements that are triggers for your pain. And then eventually it just stops hurting because we've gotten the neuroplastic loop to go away, and now just good movement feedback is occurring. So again, turn up movement and turn down pain. That's what we're doing with the neural reset. So how we're going to do this, if getting up and down off the floor for you is not a good idea because your back hurts or whatever, don't. You can do this same breath work just sitting in your chair. If you can get up and down on the floor, we space these out so that you can use the chairs to put your feet on. What we're going to do is I'm going to take Keegan through a couple reps of it, and then we're going to take everybody through it. And the most important piece of this is learning how to kind of do this type of breath technique, because that's going to start to make the nervous system feel safer. And once we go through the first one, then we'll go through the second one, so on and so forth. So Keegan, go ahead, lay down flat on your back and put your heels up on the bench. So this is called hook line, diaphragmatic breathing here. We're looking for a 360 breath. Yeah, out of the sun. And what we mean by 360 breath is your neck should be relaxed. If you want to stand up and move around, feel free to see this. So there should be no movement, no effort through the neck. And as you inhale, you should feel your ribs expand into your hands and into the floor. So the way we're going to start is, Keegan, just take a deep breath, put one hand just above your belly, one hand on your sternum, just like this. Now take a deep breath, doesn't matter how you do it, just suck it all in nice and quick. And now blow the air out through your mouth. And as you blow that out through your mouth, you're going to feel your side abs get a little bit tighter. We're going to try to hold some tension in your obliques. And now we want a silent inhale through the nose, really slow. And you'll feel your rib cage expand into your hands and into the ground. And then exhale through the mouth. And the exhale through the mouth should be much slower than the inhale through the nose. So all the way out, you'll feel your side abs tighten again. And then slow, silent inhale through the nose. We're making sure the shoulders don't move, the neck doesn't move, and that we get a 360 inflation of the ribs here. And then exhale through the mouth. It's super passive. You should kind of feel yourself melting into the ground. And you can go ahead and take a break. So anybody that wants to participate, go ahead, flip over, put your heels up. Yeah, questions? You don't want to get down on the floor. Just sit up in your chair, get comfortable, and do that same breathing pattern with your hands here. So a good way to start in this, and we've got coaches walking around, guys, so if you have questions, just throw a hand up and we'll help, and feel free to move your chair around. So I want everybody to take a really deep breath, fill your lungs up, and now force all your air out. Just blow it out of your mouth. You'll feel your side abs and your belly get a little bit tight. And now a silent inhale through your nose, and you should feel your ribs expand into the ground. You should feel those ribs expand into your top hand. And then an even slower exhale through your mouth. So the exhale through your mouth should be super, super slow. Make sure there's no tension in your shoulders. Make sure there's no tension in your neck. Now keep going through that. Go for 8 breaths. Kind of count on your own. So you've got a really big inhale through your nose. As you inhale through your nose, you should feel the ribs expand. And then exhale through your mouth, and it should be even slower. And you should feel those ribs kind of contract. And then really slow in, really slow, even slower out. And this should feel like very relaxing. The whole point of this is to like really down-regulate the nervous system, get things feeling safer so that we can start to move. Keep this one. Keegan, go ahead, lay down, put your heels up here. So a side view is going to be easier to see. So we're going to be in that same position. I'm going to adjust the chair a little bit so Keegan's heels are more kind of like in the middle of the chair. Boom, right there. In this one, closer to a 90-90 is going to be useful, but we're going to set the breath the same way. So it's a full exhale. So take a big breath, suck it in, just blow it all out. You'll feel those side abs come on. And now a really slow inhale through the nose. This is the exact same thing we just did. You should feel those ribs expand. And now, as you're exhaling, push your heels into the bench, and we're going to roll tailbone and lumbar spine off of the ground during that exhale. So you can do 3 or 4 segmentations here. So I can fit my hand underneath here to start. And now, big inhale. Now, during the exhale, we're going to do 3 rotations here. So pelvis is going to raise up, low back's going to come off. So we're going flexion and extension here. So we're doing like little baby bridges. So tailbone comes off the ground, tailbone goes back down. So right here, he's going into extension as far as he can without pain. And then he's going to go into flexion as far as he can without pain. Now, to find how far you can go and stay in your lumbar spine, if you poke your sides, find that your lowest rib. That's basically the top of your lumbar spine. So when we're going through this, as you roll up and pull your tailbone and your spine off the ground, you're going to go all the way up to where that rib is, and then roll it back down. So one exhale, you should be able to do 2 to 4, maybe 3 segmentations of that low back. So pelvis goes into extension, low back goes into extension, that's the bubble. And then you're going to peel your tailbone off, peel your pelvis off, get that tailbone and low back to roll off the ground and go right back down. And we'll do 8 breaths. So that could be 8 rolls of the low back there. That could be 16. That could be 24. But when you're inhaling, don't move. Be back to your natural position. When you're exhaling, just gently rolling through there and making sure you're not experiencing any pain. And you just sit down. I'll show you how to do the seated. No, not you. Him. All right, go ahead. Everybody lay back down, and we'll talk you through it. Yeah. Yeah, sorry. And so the point here, this should not feel like exercise. This should just feel like we're getting things to move. Okay, now everybody take a really deep breath. Full exhale. So you want to find those side abs. Just a little bit of tension here. And now, really slow inhale. Fill everything up. Feel those ribs expand. Nice and slow. And now a really slow exhale. As you're exhaling, roll your tailbone off the ground into like a little baby bridge, and now roll it back down, go to an arched back. Maybe you do 2 or 3 of those during the exhale. But by the time you finish your exhale, you're back to a natural position. Do another inhale. Feel all your ribs expand. Feel that 360 breath. And then during your next exhale, get that rotation. So pelvis tilts. You're getting the tailbone to come off the ground, the very low back to come off the ground. You're rolling that back down segmentally, so 1 vertebra at a time. You're going into extension there. And go ahead. Everybody go for 8 of those. If you have a question or you're not sure if you're doing it right, just stick your hand up in the air and one of our coaches will come around and help you directly. But this should not feel like exercise. This should feel like really nice, gentle movement on your back. To reinforce, that should not feel like exercise. It should feel like you've done a lot of breathing. And then it should also feel like you just gently moved your spine in a nice way. So the next one, I can show you guys this one. You're going to be in your chair, same breath. So I'm going to fully exhale, feel those side abs, and then silent inhale through the nose. And then during one exhale, I'm rolling down. So I'm still exhaling as I roll all the way back up. So it's very gentle. So during that exhale, I'm coming down as far as I can. I'm not looking for a stretch. I'm just moving as far as I can without pain, coming back up. If you're feeling better, you can go up here. This is going to be a little bit more load on the spine as you roll down, roll back up. You can also add a little rotation. It depends where you are with your back pain, and that's that movement variation as we kind of go through this. But the important thing is you should never have to brace, like squeeze your abs to come back up without hurting. You shouldn't have to squeeze your butt. It's all very gentle. How relaxed can you be as you do this? So everybody, full exhale. Feel those side abs. Big inhale, 360-degree breath, ribs expand. And now as you're exhaling, you're going, folding forward all the way down, and during that same exhale, you're still exhaling as you come all the way back up. It's slow, it's gentle, it's timed with however long your exhale is. And now that you're back up, another inhale, 360, exhale. Go as far as you can. It cannot hurt, it should not hurt. If it hurts with your hands up, you're gonna give yourself a hug. If it feels good to go all the way down and come back up and you're not bracing, you're not squeezing your butt, you're not squeezing your hamstrings, that's great. If you can only move like 3 inches forward and come back up, that's great. What we're doing is graded exposure to flexion with a down-regulated nervous system, with a brain that feels safer than it did when you walked in. Yeah, we're going for a C shape. We're not hinging from the hips because we want to reintroduce flexion to the spine without threat.
You take a breath when you're down. Can you breathe in between or no?
No. Exhale on the way down, same exhale on the way up.
That's the hardest part.
Yeah, the breath. So breathing mechanics and like good diaphragmatic control do contribute to a back that feels good. So if the breathing part is really hard, just working on that can be really helpful for you in general. So once you get your 8, just stop, stare at me with a blank stare, and then I'll take you guys through the next one. But this all has to be gentle. We're not exercising. We are remapping how the nervous system communicates with that region of the spine. You can. That's going to tension all the nerves more. So if it's irritating, I wouldn't. A lot of times I don't. I'm just going to roll, but I'm not going to squeeze out as much as I can. This is gentle. So I'm going to be here, coming down through my exhale, coming back up through my exhale, and then reset. Do another breath. Yeah. Yeah, so I would not tension anything on any of this because the goal is gentle, safe. Gentle, safe. I never thought I'd be in front of a bunch of people saying, like, I'm trying to make you feel safe. But it works, and we've got excellent research to show that it works. And this is one piece of a bigger puzzle, but it's a really powerful tool. So your next one is we've got a light farmer carry with the breath. And the easiest thing to do is you don't even need the farmer's carry because you're going to be doing this at home, hopefully in the morning, is you're just going to make a fist and squeeze just your arms pretty tight. And then exhale, find those side abs. And then as we're doing that big inhale, big exhale, I'm only holding tension in my hands. I'm staying as relaxed as I can through the whole trunk in the biggest marches that you can do for 8 breaths. So now we're putting a locomotion type effort into a nervous system that feels safer. So for those of you like, I walk too much and then my back starts to hurt, we're starting to build that out.
So it's on your breathing out that you're doing the march.
This one, just do that breath pattern and march the whole time. So this one's not only on the exhale. I really stress the exhale because everybody messes up the first half of that. But for the march, you're just doing that diaphragmatic breathing, trying to learn to hold tension in just your hands. And here. So just tension in your hands and nothing in the trunk, as relaxed as you can be in the trunk. It's actually quite difficult. So it's 8 breaths. So if you're doing 8 breaths, that should be about like 2 minutes if you have good control of the diaphragm. And that should feel really smooth. So when you stand up, if you have to really brace the leg you're standing on, dial it back, chill out. This is mellow. The only place you have tension is in your hands. And the point of this is you have to learn to hold tension in other places without throwing it into your back. So a lot of people with chronic back pain, as soon as they have tension, they throw it right into their back and then try to move. And that's not what we're doing. Balance is an issue. You could hold on to a chair, a wall, a couch, a rail, squeeze the rail, and then work that marching until the balance gets better. But the key here is, can you hold tension in your hands and not your trunk? It's kind of a trip, so go ahead, relax. Yeah, it's hard to do. It's hard to do. And then the very last one, guys, I like doing this at home on the couch. And we can send you all of this. So I'm going to send a follow-up. I'm going to send you a link to the video. We're going to chop the video, so just the explanations where I'm showing Keegan and stuff with each movement. We're going to make it stupid easy for you. We want you to feel better. So the forward fold, this one is the only one where the breath is different. It's nasal breathing. So it's in and out the nose. Now, if you got a real geared up spine, you're probably going to be on the back of the couch. I'm going to have a slight bend in my knees. Hands go here. I want to fold over as far as I can. I've got no pain here. Awesome. I'm going to do 8 nasal breaths, in the nose, out the nose. And while I'm doing that, I'm just going to kind of walk the dog. So get those knees moving a little bit, shift my weight side to side, whatever. If I feel a little bit better, I've got the arm of the couch, which would be somewhere here, and I can go a little farther. If I feel even better, I can support myself down here on the chair. If I feel even better, and I'm to a place where now I can do this, big inhales, big exhales, and as I'm in there, I'm getting, kind of walking the dog, I'm shifting my weight around. And on your 8th exhale, but the key here is on that exhale, you're not bracing, you're not squeezing your butt, you're not using your hamstrings to pull up, you're as relaxed as you can be. You just left the spa, standing up nice and gentle. So if you get up on the way up, that means you went too far. So I recently had some back issues, and this was one of the things that this whole thing is one of the things I used, and I started on the back of the couch. I was working with Keegan for a couple weeks, and now my back doesn't hurt at all. So that's like pretty dope. So don't be a hero. Go to a spot where you're pretty sure your back's not going to hurt. Go ahead, do those breaths, and then we'll wrap things up quickly. So it's inhale and exhale, and we don't want a flat back, Nagin. We want that back rounded. So you want as much rounding through the back as you can.
So you're breathing.
All right, so protocol, 1 to 2 times per day. Doing it early in the morning, if possible, is a really good way to kind of start the day. That's going to be gentler. And then later in the day, you can do a second burn. But it should not become habitual. It shouldn't be something like, oh, I tweaked my back, I better go through my thing. That's a compulsion. That's really not that helpful. It's not a blankie for you. It's something that we can use for a month to get that neuroplastic pain to calm down, get the nervous system to feel safer, and then have graded exposure to more and more movement. And like daily for about 4 weeks. And that's a really good timeline for this type of thing. So next one, key takeaways, same thing we started with. Movement and breath can reset the system. If we just did that well, your body should feel like a little bit calmer. It's not going to solve your back pain by doing it once, but exposure over time is going to make it better and better. We got to restore confidence. You need a positive outlook, like this can be effective. I can solve this problem. You absolutely can. We got to restore movement, build resilience. And then last 2 slides. So what now? We videoed this whole thing. Thank you, Richard. I believe the sound was working. We'll find out in a minute. But we'll put it up on YouTube. We'll send you guys all that link. We'll also chop out me instructing how to do each piece of that and hyperlink that into its own video. So it's very easy for you guys to see what were we talking about. Next steps, get an assessment with Motion, get an assessment with us. Or even better yet, do both. We both have different strengths and we work really well together. And we're really good at helping people with this specific problem. And then next one. So if you would like more information on neuroplastic pain and kind of things you can do to help yourself get better, Unlearn Your Pain by Howard Schubiner. Awesome book, and it's got a 28-day program that you can take yourself through that kind of goes into like all of the biosocial kind of aspects of chronic pain. The Way Out by Alan Gordon is a really good read. It's also an audio book, and it explains pain reprocessing therapy and who it's for, how it helps. If you want to listen to people that have been helped by this type of stuff, there's a podcast, The Science Behind the System, and that's Howard Schubiner's podcast. It's really good. And then I'm going to send an email out, but I'm looking for 5 people that want to go through the Unlearn Your Pain book and program together. And we'll meet once a week. It's going to be $100 because if you don't have any money in the game, you won't come, you won't do it. That's the only reason it's $100. But I'd like to kind of do a survey of 5 people kind of in Park City and see what kind of results do we get, and is it worth something pursuing at a bigger level. So thank you guys for coming.